episode of Just Podiatry. Very, very special day today. I recently uploaded another video to our Facebook fan page. What was inside the box? Let's take a look here. We have our brand new radial shockwave therapy machine. Extremely happy to be able to bring this new technology here to Just Podiatry. The Cliff Note version, I'm going to go ahead and do another video so everyone can really understand what it does, right? Let's go to the whiteboard here. Again, there's different names. EPAT, acronym for extracorporeal activation technology. Also, people will use the acoustic wave therapy, acoustic pressure wave therapy, radial shockwave therapy. This patient was here yesterday. Patient came in with a chief complaint of heel pain, acute heel pain. We went ahead and performed a platelet-rich plasma injection, PRP injection, and then now part two is today, which is basically, performing the three or four, depending again on the clinical presentation, but it can be anywhere between 3-4 sessions of shockwave therapy. I used to have one of these machines, and it was definitely a game changer for a lot of reasons. And I decided to. It was sort of like the missing tool in the toolbox. So we went ahead and brought it to Just Podiatry. You don't see these. You don't see these a lot around. And I think it's reasonable now that we have launched the advanced heel pain centers of South Florida to have this not only for plantar fasciitis, Achilles tendonitis, a lot of different indications, musculoskeletal indications, to be able to help patients as this young gentleman. Thumbs up, exactly, young. So we're going to go ahead and this is kind of we'll perform the procedure. And then I'm going to definitely take a little bit more time to really explain exactly, how it works and what it does. Very, very briefly, again, it's acoustic pressure waves, right, that are transmitted into, in this case, the heel, the point of maximal tenderness, and it is a regenerative type of procedure, right? We focus our efforts a lot on regeneration. I've gotten away more from the world of cortisone and synthetics. So, this also promotes. We're not going to get too complex in exactly from a physiological and cellular standpoint of what it does, but it basically also helps regenerate the area. I'm not going to say it reduces inflammation. Long term, it does reduce inflammation. What we're trying to cause here is actually something similar to the PRP, which is an inflammatory response. So let's go ahead. I don't want to bore anyone else. We already marked, by the way, I want to be very clear, lunchtime procedure, no anesthesia, no local anesthesia. We'll talk about the success rates on another video. This is a real game changer winner. What we basically do, I tell the patient, we'll put a little bit of this coupling gel there, and, we'll start, I usually tell the patient that we'll start at a lower level, and there's a numbing, in lay terms, a numbing type of effect. Once he, we'll start low. I'll ask the patient, how are you feeling? The patient will let me know. I feel a little discomfort. I don't. And, depending on what the patient tells me, will dictate, what parameters we can go to, okay? So without further ado, how are you feeling?
Good.
So, we'll start at you can come behind me, Aisha. I think it'll be a better. We'll start with about 500 shocks at a lower level, and then we're gonna beef up the power. There are certain contraindications to this procedure, and we will go ahead and discuss these at another time. The procedure itself takes about 7 minutes, and it also depends on the frequency, right? I can control all the parameters. ¿Estamos bien?
Yes.
Thank you. This is really a great alternative. It's not invasive. It's FDA cleared. This procedure is not covered by any insurance. I'm gonna put that out there. We're gonna stop here a second. I'm gonna beef up the energy a little bit. The gel is really important for a lot of reasons, right? These are acoustic waves. And the more gel, the better it is. We can combine this alternative treatment with, again, like I said before, PRP, platelet-rich plasma. We can use it as well, percutaneous microtenotomy, also known as the deep dry needling. And believe it or not, we always want to avoid the knife, even though we do perform these minimally invasive, plantar fasciotomies. It can help with the surrounding, right? With the surrounding discomfort as well. I don't like to leave it in one spot. As everyone is noticing, I'm moving the probe in a circular motion. Which is extremely important. Indications, as previously mentioned, plantar fasciitis, heel pain, Achilles tendonitis, any injuries, acute injuries, neuromas, inflammation of nerves, any tendon problems. I used to use this alone, and we can, but I noticed that putting a really nice, we'll say a regenerative protocol together is the way to go. Again, it's a series of multiple sessions. This is not a one-time treatment. I'm gonna stop here. I'm gonna give it I'm gonna increase the frequency a little bit more. As everyone can hear now, the frequency of the pulse is a little bit faster. And again, as promised, I will definitely talk about how this works and why it works. It's a little bit similar to the percutaneous microtenotomy, the deep dry needling, the physiological effects, right, which is to bring blood to the area, because blood is important to heal anything. But here in South Florida, I can tell you with certainty that not a lot of colleagues have this type of technology. Am I correct? Safe to say. I'm very excited. Everyone knows me, how passionate I am. Having this new addition is, I'm gonna have a great weekend, because I know that this is gonna help a lot of people. Right now we're up to about 1,500. So what we're gonna do now is we will continue. It's gonna be another like 3 minutes or so. I'm gonna continue to do what I'm doing. And then I will definitely upload another video, probably later today, taking a little bit of more time to explain the benefits of this type of therapy. We'll just call it for now shockwave therapy, okay? So like always, www.jellspodiatry.com, Instagram, Dr. Tojan, Jell's Podiatry, Facebook, and last but not least, our YouTube channel, Jell's Healthcare. This is going to be a real game changer for, here at Jell's Podiatry, and you'll see a lot.